Hello, my name is Dr. Jay Gottlieb. I'm a board-certified dermatologist as well as a board-certified facial plastic surgeon here at Miramar Dermatology Skin and Cancer Associates. Let's talk a little bit about malignant melanoma or melanoma. Melanoma typically is a pigmented growth that has malignant cells within it. We know that the sun is a factor. However, we have seen melanomas in areas that have not had any sun exposure. We also know that blistering sunburns early in life increase the risk of a patient having melanoma as they get older. Melanoma is the type of skin cancer that, if not treated early, can be fatal. However, if we find it early, it is treatable and curable, and the patients do extremely well. So what causes melanoma? We're not 100% sure, but we know that the sun is involved. Moles, typical moles, can change and undergo what's known as dysplasia. Patients should have their moles evaluated once a year by a board-certified dermatologist. If an abnormal mole is seen, it should be evaluated with a dermatoscope, which is a birefringent polarized light source that we're able to look below the level of the surface of the skin and evaluate the actual pigment pattern. Some pigment patterns are obviously benign and some are obviously malignant. If an area looks suspicious, a skin biopsy is done. This is a painless procedure. We use a little local anesthesia, and typically we'll use either a tangential biopsy, taking a little bit of skin off the top of the lesion, or we will use a punch biopsy, which gives us a much better evaluation as far as depth of penetration. The actual size of the melanoma is not what determines the prognosis. The depth of invasion into the skin is what determines the diagnosis. Melanoma is a type of skin cancer that can metastasize. That means it can spread. It can spread many different ways. It can spread through the blood, both arterial and venous, and it can spread through the lymphatic system. Therefore, distant metastasis from a deep melanoma is not unheard of. Our survival rate with melanoma has improved tremendously in this country. The reason I believe that this statistic exists is because we are finding them much earlier and treating more melanomas in an early stage and before they turn into the more fatal type of melanoma. So what do you look for? Any changes in moles or any new dark marks. Typically, if you have a dark mark, you evaluate it on 5 different counts. The first, A, B, C, D, E. The first is A, asymmetry. Part of the lesion looks different than part of the same lesion. B, irregular borders or scallop borders of the lesion. C, color change. You start to notice that there's actually a color change in one of these pigmented lesions. D is diameter, starts getting larger. Moles typically do not get larger once a patient reaches their adult size. E is evolution, burny, stingy, itchy, any sensation that a patient notices in a mole. So what I'm saying is any mole that has any change or any dark spot that has any change should be evaluated by a board-certified dermatologist. When we do a biopsy, the dermatopathologist will tell us the type of lesion that we biopsied. It could be just a simple mole that appears visually abnormal, but yet when it's looked at under the microscope, it's perfectly normal. Bottom line, you should have a skin exam once a year by a board-certified dermatologist, evaluating all of your moles. You are only able to see 50% of your skin. I tell my patients, if you're a male, you should have a prostate exam, colonoscopy, heart exam, and skin exam as directed. If you're a female, you should have your skin exam, breast and pelvic exam, colonoscopy as directed, and heart evaluation, cholesterol, triglycerides, and cardiogram. Nobody should die of skin cancer. A yearly exam can prevent it. In our office, we have yet to see any patient that comes in for a regular skin exam. Melanoma patients come in twice a year, and non-melanoma patients come in once a year. We have yet to have a patient develop a life-threatening skin cancer that comes to us on a regular basis. With that said, we do have at least a half a dozen patients currently in our office that have life-threatening skin cancers. These are either new patients to us or patients that we have not seen for years for whatever reason. So make it an appointment for a full skin evaluation once a year. Once you're in our system, we make sure that we see you every year by reminding you by either email, text, or a postcard. So make an appointment. You can call our office, or you can go to the Contact Us button of the upper part of the screen and request an appointment, and one of our staff members will call you and set up a time that's convenient for you. Also, if you come to our office, click the Register button up at the top and register online, filling out your paperwork. This will make for less time spent in the reception area and more time with me in the exam room having a full skin check. You owe it to yourself. I look forward to seeing you in our office. Thank you for visiting our website at Miramar Dermatology.